honey forward. And they're off.
Cheltenham, March 13.
Held up towards the back of the field.
One of the most prestigious events on the British racing calendar.
Album photo! Back-to-back Gold Cups! Album photo!
We had a big horse racing event with 250,000 people going to it, and I just thought, something not right here. There's going to be a lot of people affected by this. My dad was 88 years old, but he was so active, I couldn't keep up with him.
Darryl Blakeley died of COVID-19 as the horses took to the track and the punters packed the stands. He was the 12th victim of the virus in the UK.
Well, my dad picked up the infection because he came into contact with someone who'd just come back from a skiing trip in Italy. He didn't know he was dying, and that was really difficult. And I went into the ante-room to take all the double gloves off and the gowns, and I heard him calling my name, but I couldn't go back. I wasn't allowed to go back, so I'll never know what he wanted me for.
A leading public health expert and physician, Anthony Costello, says if it were not for the grave missteps by the British government, thousands of lives could have been saved. A turning point came, he says, on March the 12th, when the government missed an opportunity to quarantine hotspots such as London and try and contain the virus.
When at the press conference, they announced that they were stopping all contact tracing and community testing, that they were moving it all to hospitals, and they were treating it as one epidemic across the country, when we knew that it was just focused in London, maybe one or two cities in the Midlands and perhaps up north like Glasgow and Liverpool.
It took another 11 days for the Prime Minister to announce national lockdown measures at a press conference at Downing Street. By then, the death toll had reached 335, and the infection had already spread right across the country.
We just didn't take the action, and at that stage of the epidemic, 1 or 2 weeks can make a massive difference to what happens.
In the city of Southampton, southwest of London, paediatric registrar Alex Armitage is now working with adults for the first time in a decade to help ease the pressure.
Difficult decisions having to be made about end-of-life care and palliative care and who gets to go on the ventilator. So it's very, very strange times for hospital doctors at the moment.
On March 13, when the Cheltenham races were in full swing, Italy had already recorded almost 1,300 deaths from the virus. That nation's death toll is now edging toward 25,000.
And we even had, our Italian colleagues really warning us and saying, this is serious, you've got to take action now. Had we really taken decisive action then, I think we would have seen, we'd be in a position now where we're seeing much less death and disease.
A telling indicator of British complacency to the threat came on March the 3rd from a Prime Minister who would later come close to losing his own life to the virus.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know.
Don't get me wrong, I'm glad that he's making a recovery and I wish him well. But, in terms of his behaviour, he showed a real lack of leadership and recklessness.
Why was Boris Johnson shaking hands with coronavirus-infected patients on March the 3rd? Why did we allow the budget to go ahead on March the 11th, with all of them crammed up close in Parliament, when we knew that a junior minister 2 weeks earlier had developed an infection and had been walking around Westminster? We almost wiped out our entire high command. The Prime Minister nearly died.
Britain's political leadership may have survived, but across the country, families and friends are mourning in isolation for their loved ones.
Many families are live streaming to all the other people that might well normally have attended.
Maggie Kinloch is a civil celebrant now conducting online funerals and warns when the lockdown finally lifts, the trauma will be deep.
In my experience, I can imagine that this grief, which is grief upon grief, will be more difficult and may well, in some cases at least, have longer lasting consequences.
Anthony Costello believes the UK could become the worst hit nation in Europe.
It's going to be very embarrassing for us. Whether we exceed America or not, I don't know.
The Blakeley family was among the first in Britain to lose a loved one to the virus. Now, after more than 15,000 deaths, they fear the extent of the sorrow that British families may have to face.
We've tried not to focus on the anger. To be honest, it just breaks my heart because I know what each one of those families will be going through.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.